Hey Susan, how you doing?
I'm good, thank you.
Good. Okay, so for our audience out there, Susan came in to do have her legs treated for lipedema, and we just finished one side. So I'll just give you guys, the audience, a little sneak peek. Okay, so this is her leg as it is, and we just finished this one side. Susan has had just a little chance to take a look at things, but you want to stand up?
Sure.
Okay. Come on, and we'll step right up here in front of the mirror here where we have the...
Oh my God. Oh.
Okay.
I can't believe how different it looks.
Okay. So as you can see on the left side, which does not have any lemon fluid or anything in it, it's just very thick around the knees. All right, and that was one of the things that bothered you, right, Susan?
Oh yes, very much so.
Okay.
I can't wear anything that shows my knees. I have it anyway.
Okay, can you turn a little bit towards me? Okay. All right. So, and let me see your backside. And for our audience out there, do you mind if I tell them what your approximate age, or do you want?
Yeah.
Okay. So Susan's in her 50s here, and can you turn back around one more time for me?
Yeah.
You can see, she already has some looseness in her undone leg right now, but we see a little bit of looseness here too. So we can definitely do patients who are in their 50s and sometimes 60s, but the looseness does get to be more. Do you see anything that that you have any questions about?
No.
Okay.
I see a little loose skin, but I expected that.
Yeah, we have a little roll right there on the inner thigh, which was there, as a bulge before we started. So, and then we have some little bit of looseness around, crease around the knee. So it's
so much better.
Yeah, and I know this is a lot for the symptoms, and we'll talk about that in a second. But is this as a pleasing cosmetic result?
Oh yeah, I know that there's wrinkles. I don't even care if there's wrinkles afterwards. The whole thought that I could put on a pair of leggings and look normal, or go through TSA at the airport and them not check my knees, because they do that every single time.
I heard that with another patient. So, anyways, we are planning to do the upper thighs to complete the transformation and get of the for cosmetic purposes as well as for physical purposes, because this has been something physically very debilitating for you, right? Susan?
Oh yeah, very much so.
Okay. Cats can't even walk on your legs, right?
No, yeah, when my cat walks on it, it hurts. It literally hurts. Can't get a massage.
Okay. So in this video, you can sit on back here. In this video, I just want to ask Susan, to give us a rundown of how it felt. And I specifically asked Susan to do this video because she has had a lot of discomfort compared to many patients. And then just to, as a caveat, patients who have a lot of tenderness, and stay just right up in here, when they have lipedema, tend to have more discomfort because everything's already sore to begin with. But how was it for you today? And then
well, there were spots that were really painful. Around my knees was painful, but it wasn't anything that I couldn't deal with. I mean, gritted my teeth a little bit more and moaned a little bit. So, but I mean, it hurts. It hurts. It's not pain free.
Yeah.
But so worth it.
Thank you.
Oh, it is.
Any words of advice or for your lippy sisters out there that are, kind of listening, to help prepare them? Because after you gone through it, it's like, okay, well, you know what to expect now. But
well, yeah, that's what I would say. Is just not. I mean, don't think it's going to be a walk in the park. I mean, it's not easy, but again, it's so worth it to be awake and be able to see what he's doing. And I'm just absolutely amazed. I'm absolutely amazed.
Okay.
And like I said, it feels like a really, really bad sunburn right now.
Yeah. And I asked Susan to make her comments, and she's probably not expressing as much as I would have, expressed for her, and because I see patients all the time, and some people will have quite a bit of stinginess, and Susan's been tough this morning. She's endured quite a few areas where I was grabbing, and it's like, it hurts there, So anyways, when we do encounter a lot of soreness and stinginess in different areas, we have the ability to add extra lidocaine, and In Susan's case today, we are only doing one leg, and we did her right leg. Tomorrow we're going to do her left leg, because we do have limits of what we can remove. We have a 4-liter limit of fat, and we've removed about a little over 3 liters of fat already. So if we had doubled that 2 legs, it would have been 6 liters, and we couldn't have done that without breaking the state of Florida rules. And it's a little bit safer too, because we don't use as much lidocaine in one time, which would be one of the other things difficult to stay within that limit. So anyways, thank you, Susan, so much.
Thank you. So excited.
I was telling Susan that a lot of our patients have been asking, hey, do you have any patients who are a little bit older with a little looser skin? Because all, typically show are 30-something-year-olds, and their skin is usually pretty good. But, Susan, thank you so much.
Oh,
okay?
Thank you.
And hopefully we can answer your questions and help you out in the future too. Thank you.